All right, so today we're going to cover therapies, and in particular, we'll focus on psychotherapy, which are psychological techniques that are used to treat emotional and behavioral and interpersonal problems. So here the focus is on encouraging understanding of the problem, modifying feelings and behaviors in relationships. We'll talk a little bit about biomedical therapies, which use medications to address the symptoms. So in particular, we'll talk about a couple of medications and electroconvulsive therapy. So in terms of psychoanalytic therapy, this is based on psychoanalysis, which comes from Freud, which really focuses on strategies to explore repressed and unconscious impulses, anxiety, and internal conflicts. What therapists do is use carefully timed interpretations to reveal how they see the interpretation. So, for example, with free association, they ask the therapist is kind of out of view and ask questions to encourage a flow of association. Just automatically what comes to mind. Sometimes you see resistance, which is an attempt to kind of block the unconscious repressed memories or conflicts from coming to the surface or to consciousness. Psychoanalysis uses dream interpretation, where the idea is that dream images can give us information about the person's unconscious. Also, something that, as Freud argues, we see is transference, where our emotions about a significant person can unconsciously be transferred to the therapist. So they see the therapist as their mother or father or so on. An alternative to this is short-term dynamic therapy, which is like psychoanalysis, but it's time limited, and there's a very kind of specific goal, and the therapist is much more active than in typical psychoanalysis. Interpersonal therapy is one version of this, where it really focuses on a current relationship, something like unresolved grief or role disputes, interpersonal deficits, things like that. Next, we have humanistic therapies. So this comes from Rogers, who we've talked about throughout the semester. Rogers really argued that the person who coming to therapy should be called a client, not a patient. He argued they're not sick, so it's client-centered therapy. The therapist shouldn't really be doing a lot of directing, just focuses on what the client wants to talk about. It underscores the importance of genuineness, so honestly sharing thoughts and feelings by both the client and the therapist. Focuses on unconditional positive regard, where the therapist really values the client regardless of their behavior. We know that conditional positive regard from things like parents can create problems. He also underscored the importance of empathic understanding that really kind of reflects the content and personal meaning of the feelings experienced by the client, where the therapist is really engaging in active listening. And then motivational interviewing, so encouraging and strengthening the client's ability to self-motivate and change. Okay, so next we have behavior therapy. So behavior therapy came about because people argued that just understanding behavior doesn't always lead to change. So behavior therapy really focuses on changing the problematic behaviors, and this comes from a behaviorism perspective. So they assume that most behavior is learned and therefore can be unlearned. So some of this approach takes kind of a classical conditioning approach, where it's about a learned association which can lead to a maladaptive behavior. So counter conditioning is one strategy where people learn a new conditioned response that's incompatible with a previously learned response. One example of this in animals is one of the suggestions, if you have like a dog that has food aggression, is to stand kind of relatively close to the dog while they're eating and give them something extra, like give them a piece of meat or cheese, something additional. So now they've learned this, that if somebody's close to them while they're eating, it's a bad thing. But what you're doing by giving them an extra treat is counter conditioning and teaching them, well, actually, if somebody's close to them while they're eating, it's a good thing. Systematic desensitization ties into this, and here the goal is to kind of work yourself up to kind of progressively more scary things. So if you're doing, for example, the counter conditioning with a dog, you start out relatively far away from the dog, so you're not very threatening. But every day you get a little bit closer while they're eating, and so you're desensitizing them to your presence, and they get used to it by getting successively closer. Aversive conditioning is where you create an unpleasant conditioned response to a harmful stimulus. So we talked about antabuse, which is a drug that creates illness when somebody drinks alcohol as an attempt to treat alcoholism. And so this is an example of aversive conditioning. In terms of how we use operant conditioning, a lot of these focus on kind of using positive or negative reinforcement to increase incidences of desired behavior. So in some intervention programs, especially for kids, they develop this token economy where they have a very structured environment like a school or psychiatric unit, and they give people tokens for positive behavior, and they can exchange those tokens for something they want. So this works really well for things like autism. Another strategy is cognitive therapy. And cognitive therapy really focuses or argues that the reason for a problem behavior is faulty thinking about an issue, external problems or events. So rational emotive therapy is one version of cognitive therapy. And here it argues that people have disturbed views of things. It's not the things themselves that's problematic, it's these faulty expectations or irrational beliefs. So they have this ABC model, and the argument here is you need to identify the core irrational belief that underlies distress. So there's an activating event, you get passed over for a promotion at work, and that makes you miserable and distressed. But rational emotive therapy argues there's a belief that causes you to be sad after this. And that is, if you get passed over for a promotion, you believe I have to be good at everything. If not, I'm a complete failure. I failed at this. I'm worthless. And those beliefs are what actually make you feel distressed. And so rational emotive therapy works to change those beliefs, to change people's reactions to events. Another popular form of cognitive therapy, kind of the original one, was developed by Beck, and he basically argued that people experience depression because they have a negative view of the past, present, and future from these cognitive distortions that lead them to see everything in a negative way. So I'm worthless, I can't do anything, I'm unlovable. And so you have to kind of change that distorted thinking and unrealistic beliefs. And cognitive therapy really focuses on actually empirically testing it. And so if you think you always say the wrong thing, then your therapist might ask you, okay, I want you to go out and talk to people and count how many times you actually say the wrong thing. Is that actually evidence-based? So the therapist serves as kind of a model and a collaborator. Cognitive behavior therapy is another one that's very popular. And here the argument is you assume that the cognitions, the behaviors, and the emotional responses are all related. And so here the therapist focuses on challenging maladaptive beliefs, uses behavior modification like rewards and shaping to teach problem solving and change behaviors. There's a lot of evidence for cognitive behavior therapy being very effective. Therapy also doesn't have to happen kind of in a bubble on your own. So group therapies are when a therapist works with several people simultaneously. So it can be any one of these approaches we've talked about, but it's cost effective. It's useful because the therapist can actually observe interactions and encourage interactions between other group members, and they can kind of teach each other practical solutions to common problems. Family therapy is another strategy, and here, or couples therapy, and here the argument is that individuals don't live in a bubble, and the people around them influence their behavior and their thoughts and their feelings. And so we have to try to kind of change or improve interactions among all family members to make a difference. And so the argument is the family is a system, and each person plays a unique role and influences others. So for an individual to become better, the family needs to change their dysfunction as well, or the couple. Okay, so one of the big questions about therapy is, does it work? Most people with psychological symptoms don't seek help, and many of them spontaneously recover. So the big question is, does therapy offer more benefits than spontaneous remission, than just spontaneously getting better? And what they find is that a person completing psychotherapy is better than 80% of the people who did not. And the effects endure after psychotherapy is finished. So it's not a miracle cure. Some people don't improve, other people drop out of therapy, but overall, the evidence really suggests that psychotherapy is significantly more effective than not getting any treatment at all. Now, in terms of the type of therapy, though, there's not a ton of difference in terms of which type, as long as it's empirically developed and tested. So the question is, why do they all work? One reason is the therapeutic relationship is important. Having a person that you have the sense of mutual trust and hope and respect and are trying to achieve a goal with, just that process helps people. Also, there's some characteristics associated with the therapist. So having a caring attitude, being empathic, committed to the client's welfare, improve. Clients who are motivated and committed and really involved in the process are much more likely to be successful. There are also external factors. So having a stable living situation and a supportive family are all things that make therapy more effective. So there's no one specific cure-all. You need kind of a good match between the client and the technique. And a lot of therapies use kind of an eclectic method where they take what's most relevant from various different types. So next, biomedical therapy. So psychotropic medications are medications that alter mental functions and alleviate psychological symptoms. For many disorders, we use a combination of psychotherapy plus some kind of medication. So we're not going to go into a ton of details, but we'll talk about a couple of different types of medication. So first is antipsychotic medications. And so these are developed to reduce the positive symptoms of schizophrenia, hallucinations and delusions, namely. A lot of these affect the levels of dopamine. And they've been really important in dramatically reducing the number of patients in psychiatric hospitals, because this is one of the number one reasons that people are hospitalized. But it's important to note that these do not provide a cure. They only work as long as the medication is being taken. So the symptoms return if the medication is stopped, and they also don't treat the positive symptoms of schizophrenia. They also don't treat the negative symptoms of schizophrenia. One of the biggest issues is a lot of these have a lot of unwanted side effects. So weight gain, dry mouth, poor concentration, and muscle tremors. And so what was happening, especially with the first wave of antipsychotics, which are that typical antipsychotic, they alter kind of these global dopamine levels, but they have these big side effects. And so what would happen is the patients would be hospitalized, they'd get on the medication, they'd be stabilized, then they'd be released from the hospital. Because the side effects were so negative, they would stop taking the medication, which would lead them to have a psychotic break. They'd start having symptoms again and be rehospitalized. So we got this kind of cycle of people getting on medication, getting better, getting off, and getting worse. More modern antipsychotics are called atypical antipsychotics, and they affect kind of more targeted areas of dopamine, and they also affect serotonin. And so these have a lot fewer movement-related side effects. And they also can work on some patients that typical antipsychotics didn't work for. So atypical antipsychotics seem to be more effective in terms of decreasing the rate of relapse for patients. Other common medications that are used therapeutically, anti-anxiety medications are used to treat pathological anxiety. So these include benzodiazepines like Valium and Xanax. And so these can calm jittery feelings, relax muscles, promote sleep. They do have some potentially dangerous side effects like reducing coordination and slowing reaction time. And they also have dangerous interactions and can be physically addictive. Next, lithium is a medication that's used to treat bipolar disorder, and it actually counteracts both the manic and depressive symptoms and prevents relapse. Now, if someone takes too much lithium, there's the potential for poisoning, but it is quite effective at treating bipolar disorder. Another common biomedical therapy is antidepressant medications that work to address some of the symptoms of depression, like hopelessness and guilt and difficulty concentrating. There's a couple of different types. So first generation antidepressants are things like tricyclics and MAO inhibitors, and they have a lot of negative side effects. But another category, SSRIs, which are selective serotonin reuptake inhibitors, like Prozac and Zoloft and Paxil, seem to be more effective and have fewer side effects. And this is really an interesting one where some antidepressants work better than others for different people. So sometimes people have to try a couple of different ones to find one that worked. Generally, what evidence suggests is therapy can be just as effective as antidepressants at fixing depression. Next is electroconvulsive therapy. And so electroconvulsive therapy is pretty rarely used today. But essentially what this does is induces a tiny seizure in someone's brain. It short term is actually very effective for severe depression, but it's only used when other forms of treatments have failed. Part of the reason is it's pretty extreme. Sometimes it can lead to temporary or permanent memory loss. And also the effects are pretty short-lived. So most people relapse within 4 months. In an extreme case where a person is not responding to any other kind of treatment, then occasionally we do see this. This is a pretty new treatment, but I think it's interesting to think about as an alternative. It's called deep brain stimulation. And basically electrodes are implanted in the brain and provide kind of constant stimulation. And so there's significant evidence that it's helped to treat some of the tremors from Parkinson's disease. And new evidence suggests that it might be used to treat psychological disorders as well. So it's been approved for medication-resistant depression. So again, last resort. If nothing else is working, then sometimes it can be used for depression. There's some evidence for using it in OCD in patients, again, that are not responsive to any other treatment. And in children with ADHD, there's been some experimentation with this. They use external stimulation rather than internal stimulation, but a similar concept. And so this is kind of one of the newer treatments for psychological disorders, but data really seems to be supporting the safety and efficacy. So this is another potential. All right, so that is it for treatment of disorders.